time, our faces may change, and people may feel that their features suggest that they are tired, sad, or indeed older than they actually are. These changes may occur for many reasons, including genetic factors, the effects of sun exposure, and a natural decrease in the skin's elasticity. A common area for some of these changes to occur is in the forehead region, or brow, where many people complain of a drooping appearance associated with an increased amount of wrinkles. An endoscopic forehead lift, or brow lift, can provide a more youthful and firmer look to the upper areas of your face. The endoscopic brow lift has the advantage that it does not require any major incisions, rather a series of smaller, more discreet incisions around the hairline region. A series of small instruments are then used to lift the brow tissues upwards, as well as disrupting some of the muscular activity that is responsible for producing wrinkles. This procedure is able to significantly rejuvenate the upper face. However, the endoscopic brow lift may not be suitable for people with a receded hairline due to the position of the incisions, but your surgeons will be able to discuss further options with you if this is the case. An endoscopic brow lift is commonly performed under general anesthesia as a day-case procedure, but may sometimes require an overnight hospital stay. The surgery itself typically lasts between 1 to 3 hours and begins with the cleansing of the area. The surgeon may choose to part your hair with special clips and bands, or may opt to use an antibiotic type of cream to fix your hair in place. The incisions used in this procedure are very small and vary in number between 3 and 5 incisions, depending on the amount of tissue that must be lifted. The tissues of the forehead are then lifted off the underlying bone, and the actions of some muscles are deliberately disrupted in order to reduce the appearance of wrinkles. The brow is then lifted to a high position and secured in place. There are a number of different techniques that a surgeon may use to secure the brow in its new position, including the use of small implants to hold the tissues, stitches, or screws. Once the brow is lifted to the correct position, the incisions are stitched, and the surgeon may wish to bandage the area, although many surgeons do not routinely do this. Most people recover quickly following this procedure, although you should expect some discomfort, swelling, and minor bruising of the upper facial area. Light exercise is normally possible almost immediately, although your surgeon may advise you to avoid bending your head downwards for a few days in order to reduce any swelling. Most people are able to return to work in about a week after their surgery. You will notice the effects of your surgery immediately, and as the bruising and swelling fade over the next 2 to 3 weeks, the results will become more visible. The scars will be small and hidden in your hairline, but will fade over the next year into very fine lines. The full results may not be totally visible for a few months, but the end result is a more youthful, lifted brow with fewer wrinkles. The effects of the surgery usually last for several years.